Margaret was 68 when she first noticed it. Not chest pain, not the dramatic clutching at the heart you see in movies. It was something much quieter, much more subtle. She would climb the stairs to her bedroom and feel an unusual heaviness in her chest, like someone had placed a warm blanket over her lungs. She dismissed it as getting older, as being out of shape. After all, isn't that what everyone tells you? That breathlessness, fatigue and slowing down are just part of aging. 3 months later, Margaret was in the emergency room with a massive heart attack. The doctors told her that her heart had been crying out for help for months, sending signals she never recognized, signals that, if she had known what to look for, could have saved her from lying in that hospital bed, wondering if she would ever see her grandchildren grow up. Margaret's story isn't unique. Every year, thousands of seniors experience heart problems that could have been prevented or treated much earlier if only they had recognized the warning signs. The problem is, heart disease in older adults doesn't always announce itself with dramatic symptoms. Instead, it whispers, it hints, it shows up in ways that seem so ordinary, so much like normal aging, that we brush them off without a second thought. But your heart doesn't lie. When it's struggling, it will find ways to tell you, even when those ways seem completely unrelated to your chest. Today, I'm going to share with you the 5 silent signs of heart trouble that most seniors miss. Signs that could mean the difference between catching a problem early and facing a life-threatening emergency. Before we dive deep into these warning signs, I want you to know that recognizing them isn't about living in fear. It's about living with awareness, with the knowledge that can keep you healthy, active, and independent for years to come. So please take notes, share this with someone you love, and remember that knowledge is the most powerful tool you have in protecting your heart. Let me ask you something. When was the last time you felt truly rested after a full night's sleep? I'm not talking about waking up refreshed occasionally. I mean consistently feeling energized, ready to take on the day, without that lingering sense of exhaustion that seems to follow you from morning to night. If you can't remember the last time you felt that way, your heart might be trying to tell you something. You see, persistent, unexplained fatigue is one of the most overlooked signs of heart problems in seniors, especially in women. It's not the kind of tiredness you feel after a long day of gardening or playing with your grandchildren. This is different. This is the kind of fatigue that makes simple tasks feel overwhelming, that leaves you breathless after walking across the room, that makes you want to nap in the middle of the day, even though you slept 8 hours the night before. Here's what's happening inside your body when your heart starts to struggle. Your heart is a muscle, and like any muscle, when it's not working efficiently, it has to work harder to pump blood throughout your body. When your heart has to work overtime just to keep up with basic circulation, it uses more energy. That energy has to come from somewhere, and that somewhere is you, your vitality, your strength, your endurance. Dr. Sarah Chen, a cardiologist at Johns Hopkins, explains it this way. When the heart begins to weaken, it's like trying to water your entire garden with a kinked hose. The water still comes out, but it takes so much more pressure, so much more effort, that the whole system becomes strained. Your body starts rationing energy, prioritizing vital functions over the activities that make you feel alive and engaged. But here's the insidious part. This fatigue creeps up so slowly that you adapt to it without realizing what's happening. Last year you could walk around the grocery store without thinking twice. This year you find yourself leaning on the shopping cart more often, taking breaks between aisles. You tell yourself you're just getting older, that this is normal. But what if it's not? The difference between normal aging fatigue and heart-related fatigue lies in the details. Normal fatigue responds to rest. You take a nap, you feel better. You have a good night's sleep, you wake up refreshed. Heart-related fatigue doesn't respond the same way. You can sleep for 10 hours and still wake up feeling like you've been running a marathon. You can rest all weekend and still feel exhausted by Tuesday. This type of fatigue often comes with other subtle signs. You might notice that activities you used to enjoy now leave you feeling drained. That weekly coffee date with your friend becomes something you have to psych yourself up for. That garden you used to tend with joy now feels like a chore. Your family might comment that you seem less energetic, less like yourself, but you can't quite put your finger on why. Women, in particular, need to pay attention to this sign. Research shows that women are more likely than men to experience fatigue as a primary symptom of heart disease. While men often get the classic chest pain, women's hearts speak a different language. They whisper through exhaustion, through that bone-deep tiredness that no amount of coffee or willpower can overcome. If you recognize yourself in this description, please don't dismiss it as just getting older. Your heart might be working harder than it should, and recognizing this early could be the key to getting the help you need before a small problem becomes a big one. Now let's talk about something that might surprise you. Have you ever noticed swelling in your feet, ankles, or legs that seems to have no explanation? Maybe you wake up in the morning and your feet look normal, but by evening your shoes feel tight, your socks leave deep indentations in your skin, or your ankles look puffy and feel tender to the touch. Most people chalk this up to standing too long, sitting too much, or eating too much salt, and sometimes that's exactly what it is. But for seniors, unexplained swelling, especially in the lower extremities, can be one of the earliest signs that your heart isn't pumping as effectively as it should. Let me tell you about Robert, a 72-year-old retired mechanic who loved working in his garage, fixing old cars, and staying busy with his hands. Robert started noticing that his work boots felt tighter at the end of the day. At first, he thought maybe his feet were spreading with age, or perhaps he was standing on the concrete floor too long. But over the course of a few months, the swelling got worse. His wife noticed that when he took off his socks at night, there were deep grooves around his calves. His ankles looked swollen, almost balloon-like. Robert did what many men his age do. He ignored it. He bought bigger shoes, looser socks, and told himself it was just part of getting older. It wasn't until he started feeling short of breath while working on a carburetor that he finally agreed to see a doctor. That's when they discovered that Robert's heart was working at only about 40% of its normal capacity. The swelling in his legs was his body's way of telling him that his heart couldn't keep up with circulating the blood effectively. Here's the science behind what was happening to Robert and what might be happening to you. Your heart pumps blood throughout your body in a continuous cycle. When your heart is strong and healthy, it pumps blood out to your organs and tissues with enough force to ensure that the blood can make the return journey back to your heart and lungs. But when your heart starts to weaken, that return journey becomes more difficult. Blood begins to pool in the lower parts of your body, particularly your legs, ankles, and feet, because gravity makes it harder for weakened heart to pull that blood back up. As blood pools, fluid leaks out of your blood vessels and into the surrounding tissues. That's what causes the swelling, medically known as edema. The swelling usually starts subtle. You might notice that the impression from your socks lasts longer than usual, or that your shoes feel snug at the end of the day. Some people notice that pressing on their ankle or shin leaves a temporary indentation, like pressing into soft clay. This is called pitting edema, and it's a classic sign that fluid is accumulating where it shouldn't be. But here's what makes this particularly tricky for seniors. Many older adults have other conditions that can cause swelling. Arthritis can cause joint swelling. Certain medications, like blood pressure medications or anti-inflammatory drugs, can cause fluid retention. Kidney problems can cause swelling. Even sitting for long periods, which many seniors do more frequently, can cause temporary swelling. So how do you know if the swelling you're experiencing is related to your heart or something else? The key is in the pattern and the progression. Heart-related swelling typically affects both legs equally. It gets worse throughout the day and improves overnight when you're lying flat. It often starts in the feet and ankles and gradually moves up to the calves and shins. And importantly, it tends to worsen over time rather than staying the same or improving. If you press on the swollen area and it leaves an indentation that takes more than a few seconds to bounce back, that's significant. If the swelling is accompanied by other symptoms like shortness of breath, fatigue, or rapid weight gain, that's even more concerning. Many people don't realize that rapid weight gain can be one of the most telling signs of heart problems. We're not talking about the gradual weight gain that might come from less activity or changes in metabolism. We're talking about gaining 3 to 5 pounds in a matter of days without any change in your eating habits. This rapid weight gain is usually fluid retention, and it's your body's way of telling you that your heart isn't managing fluid balance the way it should. If you're experiencing unexplained swelling, especially if it's getting worse over time or accompanied by other symptoms, don't wait to see if it goes away on its own. Early intervention can make an enormous difference in heart health outcomes. Sometimes, simple changes in medication or lifestyle can reverse the problem completely. But the key is catching it early, before your heart has to work so hard that it starts to fail. Here's something that might catch you off guard. The third silent sign of heart trouble has nothing to do with your chest, your breathing, or your energy levels. It has to do with your stomach. Have you been experiencing persistent nausea, especially around meal times? Do you find that foods you used to enjoy now make you feel queasy or uncomfortable? Are you losing your appetite for no apparent reason or feeling full after just a few bites? If you answered yes to any of these questions, your heart might be sending you a message through your digestive system. This connection between heart problems and stomach issues surprises many people, but it makes perfect sense when you understand what's happening inside your body. Let me share the story of Eleanor, a 74-year-old grandmother who prided herself on her cooking. Eleanor had always had a healthy appetite and loved preparing elaborate meals for her family. But over the course of several months, she began to notice that food just didn't appeal to her the way it used to. She would sit down to eat and feel full after just a few bites. Sometimes she would feel nauseous for no apparent reason, especially in the mornings. Eleanor's family thought she might be developing a stomach bug, or perhaps early signs of dementia affecting her eating habits. They encouraged her to see her doctor, thinking she might need medication for nausea or tests for digestive problems. What they discovered shocked everyone. Eleanor was in the early stages of heart failure, and her digestive symptoms were actually her heart's way of calling for help. Here's the connection. When your heart begins to struggle, it affects blood flow throughout your entire body, including to your digestive organs. Your stomach, liver, and intestines need a steady supply of oxygen-rich blood to function properly. When your heart can't pump effectively, these organs don't get the blood flow they need, and they start to malfunction. Additionally, when your heart is working harder than it should, your body goes into a kind of conservation mode. It prioritizes blood flow to vital organs like your brain and kidneys and reduces blood flow to what it considers less essential functions, like digestion. This is why people with heart problems often experience a loss of appetite, nausea, or feelings of fullness, even when they haven't eaten much. There's another mechanism at play here as well. When your heart struggles to pump blood effectively, pressure can build up in the veins that carry blood back to your heart. This increased pressure can affect your liver and cause it to swell slightly. A swollen liver can press against your stomach and other digestive organs, creating feelings of fullness, nausea, and discomfort. Some people with heart problems also experience what doctors call early satiety, which means feeling full after eating very small amounts of food. This happens because the increased pressure in your abdominal blood vessels can make your stomach less able to expand normally. You might sit down to eat your usual breakfast and find that after just a few spoonfuls, you feel completely full, even though you know you haven't eaten enough. The nausea associated with heart problems often has a particular quality to it. It's not usually the sharp, urgent nausea you might get from food poisoning or a stomach flu. Instead, it's more of a persistent, low-level queasiness that comes and goes throughout the day. Some people describe it as feeling vaguely unwell, like something is off, but they can't quite identify what. This type of nausea is often worse in the morning and may improve slightly as the day goes on. It might be accompanied by a general feeling of malaise or that heavy feeling in your stomach that makes you not want to eat. Some people also experience what they describe as a metallic taste in their mouth, or find that their favorite foods suddenly taste different or unappealing. For women, these digestive symptoms can be particularly important to recognize. Research has shown that women having heart attacks are more likely than men to experience nausea and vomiting as primary symptoms. While men typically get the classic chest pain radiating down the left arm, women's heart attacks often present with what doctors call atypical symptoms, including digestive upset, fatigue, and jaw pain. If you've been experiencing persistent digestive issues without an obvious cause, especially if they're accompanied by any of the other symptoms we've discussed, don't assume it's just a stomach problem. Your digestive system might be reflecting what's happening with your heart, and addressing the underlying heart issue could resolve the stomach problems completely. The key is recognizing patterns. If your digestive symptoms seem to worsen with physical activity, if they're accompanied by unusual fatigue or shortness of breath, or if they represent a significant change from your normal patterns, they deserve medical attention. Early recognition of these subtle signs can make the difference between a manageable heart condition and a medical emergency. Now let's discuss something that happens to many seniors, but rarely gets connected to heart health. Have you noticed that you've been feeling dizzy or lightheaded more often lately? Maybe when you stand up quickly from a chair or get out of bed in the morning. Perhaps you've experienced moments where you feel like the room is spinning slightly, or times when you need to steady yourself against a wall or piece of furniture. Most people, including many doctors, attribute dizziness in seniors to normal aging, blood pressure medications, or inner ear problems. And sometimes that's exactly what it is. But persistent or worsening dizziness can also be one of the subtlest early warning signs of heart problems, and it's one that's frequently overlooked until other, more obvious symptoms appear. Let me tell you about Frank, a 69-year-old retired teacher who began experiencing dizzy spells about 6 months before his heart attack. Frank was an active man who still coached Little League baseball and took daily walks with his dog. But he started noticing that when he stood up from his recliner to answer the phone, he would feel momentarily lightheaded. At first, it lasted just a second or two, and he dismissed it as standing up too quickly. Over time, the episodes became more frequent and lasted longer. He would feel dizzy when climbing stairs, when bending over to pick up something, or sometimes even when sitting still. Frank's wife suggested he see a doctor, but Frank, like many men his age, was convinced it was just part of getting older. He even joked about it, saying he was becoming a wobbly old man. The dizziness wasn't Frank's only symptom, but it was the one he noticed most. Looking back, he realized he had also been feeling more tired than usual and occasionally short of breath. But the dizziness was what bothered him most because it made him feel unsteady, uncertain on his feet. It wasn't until he fainted during a baseball game that he finally sought medical attention. That's when they discovered that Frank had developed an irregular heartbeat that was affecting his heart's ability to pump blood effectively. Here's what was happening to Frank, and what might be happening to you if you're experiencing similar symptoms. Your brain requires a constant, steady supply of oxygen-rich blood to function properly. When your heart isn't pumping efficiently, the amount of blood reaching your brain can fluctuate, especially during times when your body needs to quickly adjust blood flow, like when you stand up or change positions. Normally, when you stand up from a sitting or lying position, your cardiovascular system makes rapid adjustments to ensure that blood continues flowing to your brain despite the effects of gravity. Your heart rate might increase slightly, and blood vessels in your legs might constrict to help push blood back up to your heart. But when your heart is struggling, These adjustments might not happen quickly or effectively enough, leading to temporary decreases in blood flow to your brain. This is why heart-related dizziness often occurs with position changes. You might feel fine sitting down, but feel lightheaded when you stand up. You might feel steady on level ground, but dizzy when climbing stairs. The common thread is that your heart is having trouble keeping up with the increased demands placed on it during these activities. There are several different ways that heart problems can cause dizziness. If your heart rhythm becomes irregular, called arrhythmia, your heart might not pump blood consistently. Sometimes it might pump too fast, sometimes too slow, and sometimes irregularly. This inconsistent pumping can cause fluctuations in blood pressure that your brain interprets as dizziness. If your heart muscle itself is weakening, a condition called cardiomyopathy, it might not be able to pump forcefully enough to maintain steady blood pressure, especially during physical activity or position changes. This can lead to what doctors call orthostatic hypotension, which is a fancy way of saying that your blood pressure drops when you stand up. Sometimes, problems with the electrical system of your heart can cause pauses in your heartbeat or very rapid heart rhythms. During these episodes, your brain might not get enough blood, leading to dizziness, lightheadedness, or even brief episodes of feeling like you might faint. The type of dizziness associated with heart problems often has certain characteristics that can help distinguish it from other causes. It's usually not the spinning sensation you get with inner ear problems. Instead, it's more of a lightheaded feeling, like you might faint or like your head is floating. Some people describe it as feeling like they're about to lose consciousness or like they need to sit down immediately. Heart-related dizziness is also often triggered by specific activities or position changes. It might happen when you stand up quickly, when you exert yourself physically, or during times of stress. Some people notice that it's worse in hot weather or when they're dehydrated, because these conditions put additional stress on the cardiovascular system. If you're experiencing dizziness, pay attention to when it happens and what triggers it. If it's consistently related to standing up, physical activity or exertion, that's more concerning than dizziness that happens randomly or seems related to head movements. Also, pay attention to how long the episodes last and whether they're getting more frequent or more severe over time. Most importantly, if dizziness is accompanied by chest pain, severe shortness of breath, or if you actually faint, seek medical attention immediately. These could be signs of a serious heart rhythm problem that needs urgent treatment. Now, let's talk about the fifth and perhaps most overlooked sign of heart trouble in seniors. This one might surprise you because it doesn't seem to have anything to do with your heart at all. I'm talking about changes in your sleep patterns, particularly difficulty sleeping or waking up frequently during the night feeling short of breath. Sleep problems are so common among seniors that most people assume they're just part of aging. You go to bed tired, you wake up tired, you toss and turn, you wake up multiple times during the night. Sound familiar? While it's true that sleep patterns do change as we age, persistent sleep difficulties, especially when accompanied by breathing problems, can be an early warning sign that your heart is struggling. The connection between heart problems and sleep issues is complex and often misunderstood. Let me explain what might be happening in your body when you lie down to sleep. During the day, when you're upright and moving around, gravity helps your heart circulate blood throughout your body. Your legs act like pumps, helping to push blood back up to your heart. But when you lie down flat, your heart has to work differently to maintain circulation. If your heart is already struggling during the day, lying flat can make those struggles more apparent. Fluid that might have pooled in your legs during the day suddenly redistributes throughout your body when you lie down. This can increase the volume of blood your heart has to pump, and can put extra strain on a heart that's already working too hard. Many people with heart problems develop what's called orthopnea, which is difficulty breathing when lying flat. You might find that you need to sleep propped up on multiple pillows to breathe comfortably, or that you wake up in the middle of the night feeling like you can't catch your breath. Some people find themselves getting up several times during the night to sit on the edge of the bed or walk around until their breathing improves. There's also a condition called paroxysmal nocturnal dyspnea, which is a frightening experience where you wake up suddenly, usually 1 to 3 hours after falling asleep, feeling like you're suffocating. You might wake up gasping for air, feeling panicked, with your heart racing. These episodes are terrifying when they happen, and many people assume they're having panic attacks or nightmares, but they can actually be a sign that your heart is struggling to keep up with the demands of circulation while you sleep. Let me share the story of Dorothy, a 71-year-old retired nurse who began experiencing sleep problems about a year before she was diagnosed with heart failure. Dorothy had always been a good sleeper, but she started waking up frequently during the night, feeling restless and uncomfortable. She would often find herself getting up to use the bathroom multiple times, thinking that was the problem. But Dorothy began to notice a pattern. She felt most comfortable sleeping in her recliner rather than in her bed. When she tried to sleep flat, she would feel like her chest was heavy, like someone was sitting on it. She would wake up feeling like she needed to cough, or like she couldn't get a deep breath. Her husband suggested she might be developing allergies or asthma, since she had never had breathing problems before. As a nurse, Dorothy was more aware of symptoms than many people, but even she didn't initially connect her sleep problems to her heart. It wasn't until she started experiencing swelling in her legs and increased fatigue that she began to put the pieces together. When she finally saw a cardiologist, she learned that her heart's pumping function had decreased significantly, and the sleep problems she had been experiencing were early signs of heart failure. Sleep problems related to heart issues often have certain characteristics. You might find that you sleep better sitting up or propped up on pillows. You might wake up feeling like you need to cough, or like there's mucus in your chest that you can't clear. Some people wake up with a feeling of anxiety or panic, not because they're worried about something, but because their body is responding to the stress of not getting enough oxygen. Another common pattern is waking up frequently to urinate. When you lie down, fluid that has accumulated in your tissues during the day gets reabsorbed into your bloodstream. If your heart is struggling, your kidneys might respond by trying to eliminate this excess fluid, leading to frequent trips to the bathroom during the night. Some people also experience what they describe as restless sleep. They toss and turn, can't get comfortable, and wake up feeling unrefreshed even after 8 hours in bed. This happens because your body is working harder than it should during sleep, trying to maintain adequate circulation and oxygenation. The key to recognizing heart-related sleep problems is understanding that they represent a change from your normal patterns. If you used to sleep well lying flat but now need multiple pillows, that's significant. If you used to sleep through the night but now wake up frequently feeling short of breath, that's worth investigating. If you wake up feeling like you're drowning or suffocating, especially if this happens regularly, that's a red flag that needs immediate medical attention. It's also important to recognize that sleep problems can create a vicious cycle with heart problems. Poor sleep puts stress on your cardiovascular system, and heart problems can worsen sleep quality. Breaking this cycle often requires addressing both the heart condition and the sleep issues simultaneously. Now that we've discussed these 5 silent signs, I want to emphasize something crucial. Recognizing these warning signs isn't about becoming paranoid or assuming the worst every time you feel tired or dizzy. It's about being an advocate for your own health, about understanding that your body is constantly communicating with you and learning to listen to what it's saying. The key to all of these symptoms is paying attention to patterns and changes. Is your fatigue getting worse over time? Is the swelling in your legs becoming more pronounced? Are your digestive issues accompanied by other symptoms? Are your dizzy spells becoming more frequent? Are your sleep problems affecting your quality of life? If you recognize yourself in any of these descriptions, especially if you're experiencing multiple symptoms, don't wait to see if they go away on their own. Heart problems are progressive, meaning they tend to get worse over time if left untreated. But the good news is that when caught early, many heart conditions can be managed effectively, allowing you to maintain your independence, your energy, and your quality of life for years to come. The most important thing you can do right now is to start paying attention. Keep a simple journal of how you're feeling each day. Note your energy levels, any swelling you notice, digestive issues, dizzy spells, or sleep problems. This information can be invaluable when you speak with your doctor, helping them understand exactly what you're experiencing and how it's affecting your daily life. Remember, you know your body better than anyone else. If something feels different, if something has changed, trust that instinct. Don't let anyone, including healthcare providers, dismiss your concerns as just getting older. Aging doesn't have to mean accepting declining health as inevitable. With the right knowledge, the right care, and early intervention, you can protect your heart and maintain your vitality for years to come. Your heart has been beating faithfully for decades, working tirelessly to keep you alive and healthy. Now it's your turn to listen when it needs help, to recognize when it's struggling, and to get the care it deserves. Because you deserve to feel strong, energetic, and confident in your body, regardless of your age. If this information has been helpful to you, please share it with someone you care about. Heart disease remains the leading cause of death among seniors, but it doesn't have to be. With awareness, early detection, and proper care, we can change those statistics one person at a time. Take care of your heart, and it will take care of you.